Hey everybody, I'm Claudia Morandi, founder of the Don't Punish Pain Rally organization, as well as the Doctor Patient Forum. So if you follow me, it's probably because you're a pain patient who can no longer access pain medication, or you're a doctor who's been terrorized by the DEA, who works in tandem with the medical board, or you're a doctor who's tired of watching patients suffer, or you're a nurse who works in the hospital and is disheartened at what's happening to the healthcare system and how poorly pain patients are being treated. I went on social media, it's going to be 4 years ago in October, and I announced I was going to have a national protest for pain patients who have been left homeless in the medical community. And I started with 3 or 4 members, and today we have over 10,000. We have chapters in Australia, Canada, the UK, and we've done this all volunteers. There's been no money behind this movement, and I've only used social media to get the word out. And now I'm on all social media forums. And if you're watching this, it's probably because you just found me. If you Googled chronic pain patient suffering, and I mean, there's a lot of people who do what I do. What's different about my organization, I work directly with doctors. So we really support our clinicians. And we have doctors who have been sent to prison for 40 years. It's just disgusting. It's this vehement approach. And this was really all promulgated. If you follow this event, if you follow what's happening to the pain community, it's all been promulgated by PROP and all the other hateful anti-opioid crusaders. But what we're seeing now is we're seeing a lot of people in the addictions community come out and speak on behalf of the pain community, and they're saying, wait, what's going on? This Andrew Kolodny and Jane Ballantyne and all the rest of them, they have turned the pain community against the addictions community. But yet all of this money has been made off the backs of addicts, and nobody's seen any money. Like it hasn't gone into recovery centers. It's probably all just been given, to the state's general fund. And I don't follow politics too clearly, so I can't be quoted. But also, as we have reduced prescribing by close to 43%, we are overdosing, and we're going to continue to overdose. We're skyrocketing. And the anti-opioid crusaders will say, well, that's because of COVID. No, it's not. It's because we don't have a prescription pain medication problem. While overprescribing was happening in the country, it's now being overprescribed, but in Suboxone. In every street corner, when you're at that red light, you see, get your Suboxone here. And Suboxone was never intended to be on for long periods of time, but now we see pain patients being forced of their, against their will. They've been forced off of their oxycodone, their OxyContin. That's got a horrible name because of what the media has done. Which, by the way, OxyContin was a one and done drug. You take one, it was just, it's been a blessing for so many people. So what's going on? When is it going to get better? Chances are, if you've been fortunate enough to find a doctor to maintain your pain management, you've already been force tapered, so you're suffering. And perhaps you've gone into pain management one day and they said, we can't prescribe, you failed your urine drug test. You said, why would I fail my urine drug test? Well, there wasn't any medication in your system, so you probably were selling it. You weren't selling your medication. Those urine drug tests, those are prone to human error. So many hands have touched your urine by the time it even makes it to where it needs to be. So that's another horrible situation. Or you've gone into your doctor's office one day and he or she is no longer there. They've retired, but you never knew he was going to retire or she was going to retire. Or most shockingly, the DEA has raided them because they were considered to be high prescribers. But who else would prescribe your medication but a pain management doctor? The CDC has created the pain patient genocide, and they instructed primary care physicians to pretty much not prescribe, so all PCPs stopped prescribing. So why wouldn't a pain management physician be the highest prescriber? So if you're lucky to pass that urine drug screen, you're lucky to find a doctor, chances are when you get to the pharmacy, it's going to be a nightmare there. You'll be treated poorly. Or your insurance carrier will come back and say, well, we can't pay if it's over 90 morphine milligram equivalent. Why is all of this happening? Because of the false narrative that was started surrounding opioids. Well, people definitely got addicted to opioids. I would be remiss if I didn't say that. They have attacked the most vulnerable community, the disabled community. And I really don't know what president is willing to hear the cries of pain patients. So it's been thrown in our lap. It's up to us to fight for what's right. And it's up to us to regain the power. So what I need you to do is I need you to join the Facebook page Don't Punish Pain Rally, because I'm on every social media platform and I receive probably 400 to 600 messages every 3 days. So I will always get back to you, but I need to have everybody in one place because we rally on October 7th. So we're in the middle of this pandemic and we're in the middle of the Black Lives Matter protest. So it's going to be tricky, but it needs to be done. And I'm going to tell you why. It's because those 2016 CDC guidelines are going to be rewritten in 2021. And this is our chance to get out there, to be seen, to be heard, to regain the power. And we are headed to DC in 2021 because we no longer want the DEA to be able to access the PDMP without a court order. That has to stop. And we're working on that. But for the time being, what you can do to help, what I can do to get you help that you need, is to join the Facebook page Don't Punish Pain Rally, or visit the website don'tpunishpainrally.com to find out where your rally will be held. All rallies will have a presence at your state's capital, but there'll be several thousand planned outside of CVS on the sidewalk, outside of Walgreens on the sidewalk, outside of DEA, outside your state's medical board. But I need you all in one place, and that's either that Facebook page, and I don't like Facebook, I don't like social media, but it's necessary. So please, if you are suffering, or if you have a loved one who's suffering, if you have COVID and you're suffering, you can't get pain medication, please join Facebook Don't Punish Pain Rally. Visit don'tpunishpainrally.com. Or if you're a doctor and you want to help, you can find me at either don'tpunishpainrally.com or the Doctor Patient Forum. Never stop fighting. I promise you, things are going to change. The false narrative that's been polluted into our country has been done with the help of all of these anti-opioid crusaders who are making millions and millions of dollars off the backs of both patients and addicts. You keep fighting, I'll keep fighting. Facebook, don'tpunishpainrally.com. Have a great day.